In many ways, my presentation and what I've been asked to talk about in terms of opportunities and challenges is slightly backwards in terms of what Medilink West Midlands does or what Medilinks do. You've already been exposed to. So when we talk about the HSN, when we talk about Mercia, that's the sort of thing that we will provide you with. We are a business support organisation. So forgive me that we're slightly a roundabout face, but what I will do nevertheless is talk to you about what we do. We work with companies such as yourselves. Some of you know us. I know we work with Everlist. Hopefully you'll speak highly of us and what we do. If you don't, wait till I've gone and then speak, so please. We've been around a while. Medilink West Midlands was established in 2002 under what was known as a regional development agency in those days, which was Advantage West Midlands. So this is long before the advent of AHSNs and many other things. We're membership organisations, but we don't just work for and on behalf of members. We are an industry organisation. We all come from private sector industry, and we hopefully understand what it is that makes you tick and what it is that you need in order to keep ticking. We in the West Midlands have around about 100 fee-paying members, and we regularly interact, whoever wrote that should have been shot, with around about 800 organisations at any one time. You can see there the size of the database that we have and the contacts that we work. We work on knowledge. That's our USP. We're part of Medilink UK, so we cover the whole of the UK. There are 8 regionally based Medilinks and Medilink affiliated organisations, and between them we employ that amount of staff. We all do the same sort of thing. We may not all be called Medilinks, but we exist to help businesses to survive, to thrive, to prosper. And in terms of a national profile, we also lobby government. We work with other organisations in terms of national initiatives, Department of Health, etc., etc. We work with the HSN. Neil's already spoken to you a reasonable amount in terms of what the HSN does. We provide the industry focus, so we understand you, we do the triaging. You can talk to the HSN. There's nothing to stop industry getting to the HSN and talking to the HSN directly. Very often those sort of things can be difficult to find, so industry usually comes through us first, and then we work with you in terms of working with the HSN. And we do it in the push and the pull, which Neil introduced you to. So the push is your technologies, your products, your services that you're trying to push into the NHS. And then there's also the pull, which is very much the what everybody wants to see, which is the NHS wanting your technologies, wanting your expertise. The one thing that hasn't really been discussed that much this evening, we are nothing if not pragmatic in our approach in terms of working with industry. And when Martin asked if Medilink would do a short presentation in terms of the opportunities and challenges, when Chris, my colleague, he would normally come and do this, but he's not available. So when he asked me if I would do it, and so I start thinking about the opportunities and challenges with regards to this sector. They're many and varied. There's plenty of opportunities, certainly. Equally, there are many challenges, and they should never, ever be underestimated in terms of trying to sell products into this market, and particularly the UK market. Other speakers quite rightly have identified we are 1% of the global market, but we're nevertheless we tend to focus on our own UK market before we do anything else. You may or may not have heard of the Accelerated Access Review. The reference is down there. You can find it easily enough online. And it's a government review of innovative medicines and medical technologies in terms of how easy it is to get those to the patient. It's only just, it's a review. It has recommendations for government. None of those have been accepted yet. But these are just some of the things that are mentioned within that review. So the approach to accessing innovation in the NHS has become increasingly challenging. It always was, and it always has been. So to hear that it's become increasingly challenging is not particularly good news. We saw opportunities for acceleration at every stage of approval and adoption. There are, unquestionably. Breaking down the barriers that exist in terms of that, those opportunities is another matter. Collaboration and early dialogue between innovators and the NHS will be critical. That's why you're here, and certainly that sounds like that's happening in all of your individual cases, by definition, because you're here. Need to maintain that, need to keep that up. Encourages the NHS to work more collaboratively with patients and innovators to provide the type of data all innovators and thus healthcare systems need to make decisions about the real benefits of innovation. The historical model where innovators simply throw new products at healthcare systems and allow them to layer those onto existing pathways is no longer viable. That's really, really important. It's suggesting that collaboration is something that you need to do right from the beginning. And collaboration with NHS organisations like the AHSN, working with academia like Warwick University is really, really important. Please, please, please don't ignore it, because it will prolong the very, very long time, potentially, that it could be for the NHS to take up your technology. We believe that healthcare systems and innovators need to work together to demonstrate the way in which innovations change pathways and improve outcomes. This is particularly true with digital. Everybody here, that should be good news, and theoretically it is. And finally, most of the major recommendations of this report will need enhancement of digital capabilities within the NHS. Again, very good news if you're digitally focused, but nevertheless, you've got to persuade the NHS to move with you. That in itself is very, very difficult. Please, please, if you take one message from me away with you tonight, don't underestimate how difficult it is to penetrate the NHS. Neil mentioned about a whale and a shoal of fish. Well, yes, it is. But it is really, really difficult to penetrate. This has already been covered, but the market, what we call market and clinical support infrastructure, there is lots of it. There really is lots of it. That may be slightly out of date. I think Neil had 44. That may be slightly out of date, but nevertheless, the main centres are there. They are able to help. Working through Medilink, working through the AHSN, you will be able to access a lot of the support there. And then equally, very kind hosts tonight are on that list in terms of the academic support that's there, R&D activities, etc., etc. Medilink exists to understand all of this. We know what's going on within the marketplace, both West Midlands-wise and UK-wise, and we can help you. Whether you become a member of ours or not, we can help you. We can signpost you dependent on your particular circumstances and where you need to go. Any questions? No. Yes. Yeah, funnily enough, when we say we're an industry organisation, so we exist to help industry, very often I wonder whether I should stand up here and say the first thing you should do is to perhaps not target the NHS. The NHS is very, very difficult to penetrate. I don't think that should be hidden from industry. I think we would be doing you a disservice if we were to say anything other than that. On saying that, if you can work with the NHS and if you can get your products or services and get some of that growth, then of course the rewards from an industry perspective are huge. And there are ways to do it. The HSNs exist. Neil would argue that they exist solely to break down some of those barriers, but that's a big remit of the HSNs, is to break down those barriers.
I ask because we've deliberately not gone to the NHS, we've gone to the independent, the CIC.
Okay.
First.
Yeah. Is it a product or a service you have?
Yes, both.
Both. Oh, right. Okay. What about overseas? Have you done anything overseas?
Not yet.
Not yet. Right. Very often we find companies, traditional companies, if you like, certainly from within this region, I hate the phrase, but I'll use it, metal bashing type organisations that have developed products. They often find, sadly, that it's easier to sell those products overseas than it is to get them sold into the NHS.
Really happy to support that, actually.
Sorry?
Really happy to support that statement from the nursing portfolio, but I could share case studies perhaps at another point of companies we have, which are medical device companies, that were bashing their head against a brick wall trying to sell to the NHS. They moved overseas to an emerging market economy and products flying off the shelves.
And the NHS is commissioning a lot more work outside into these independent companies.
Yeah, there are so many barriers that exist, and nobody puts them up in deliberately, but they are there. And part of the knowledge, depending on what your product or service may be, whether it's high capital or whatever it may be, part of I like to think what we can provide you with is knowledge around. Are you aware of this? Are you aware of that? Talk to them because they will be able to guide you, etc., etc. So that's part of what we do.
I see at the moment, this last 4 or 5 months, a lot of sort of, I know I was talking to Martin about it earlier, with smoke and mirrors around sort of local digital roadmaps, SDP plans, this, that and the other that have sort of halted things a little bit for me, and obviously my company as an SME, by saying, look, we're currently looking at this at the moment, we're waiting for money, we're waiting for this plan to be done. Is there anything that, I know that obviously Tammy and the guys over at the AHSN are aware. I mean, I've been to an event all day today for STPs, but what else can we do to look at being able to say, look, you're asking for solutions, you're saying you want to commission something, but then you're actually saying, you know what I mean, we're not actually sure what we're looking for.
Mm-hmm.
So is there anything that you can do as I suppose, an organisation to help with those links at this moment in time?
Yes and no. We don't have magic bullets, as you can imagine. Otherwise, we'd be selling them for lots and lots of money. There is a lot of, and you know, this is my view on it. There is a lot of what I consider to be noise. Always, it's continual. The continual changes within the healthcare system. You know, your views on that in terms of whether it's necessary and does it achieve anything would be your views. I have mine. In terms of can we or can you do anything to sort of subvert that, to get round that? In short, no. But forewarned is forearmed. You already know. You are quite knowledgeable in terms of what's going on. Imagine, so for instance, STPs, AHSNs, SBRI, all that sort of thing. A lot of the things that have been talked about tonight. Imagine you're starting out and you're doing whatever you're doing and don't know any of that. Then it really does elongate your pathway. Can we shorten your pathway? Potentially. The AHSNs at the moment are, in my view, the best possible chance of shortening that pathway. Does that make it? No, it does make it easier. Will that guarantee success? How much time will it shorten? I really don't know. But you're in the best space.
I mean, it's just I've heard a couple of people, I've chatted with a couple of people in the room tonight that have obviously got products to market in a certain arena, maybe not the NHS, some that have had millions of pounds worth of funding but still not sold into the NHS.
Yep.
And obviously I've heard comments about SBRI not having the right tact and things like that, and they know they're going through their own changes. But for my personal take on things, I'm still keen to say, what else can a network do? It might be something for yourselves as the win, to actually bring the people together, because you try your best, don't you, to partner people and say, look, what's your need? These are SMEs in the area that obviously can meet that need. What else can we do in the West Midlands to sort of help with that? Because they're all saying they have needs, but they're going out and, I don't know.
Yeah. One of the things that we are doing, and in conjunction, because we're a Medilink, first and foremost, so we exist to try and do anything we possibly can that's legal to help industry, generally SME industry, but we also then provide a service to the HSN, because the two things, they link, or they should. One of the things that we're doing is we're setting up, and if you're on our database, you'll get notification of this, what we're calling an industry focus group. So this is us as Medilink working with the AHSN, but nevertheless with a Medilink hat on, going out to industry and saying to industry, this is what's currently going on. So these are initiatives, so things like STPs, that type of thing. This is what's going on. This is what the AHSN are doing. This is what's happening. What do you want to happen? Is the AHSN focused where you want it to be focused? Do you have any specific questions? Do you have any specific demands? Do you have any specific complaints? Do you have any specific congratulations? It's all of that type of thing. So we can feed back, and what we're hoping to do is to regularly interact personally with business and the AHSNs in a forum type approach, so that the dialogue is improved. Because at the moment you'll have your dialogue individually, as will a few of you, but then what we want to do is to bring that collectively and also work across the whole of the UK if we can to do it. It's really, really difficult. We know of organisations that have banged their heads against the wall for a long, long time and seem to be going nowhere. But there are opportunities. We can get... Equally, I can give you examples of successes. But I really wouldn't want people to think that it's dead easy, because it isn't. But it can be done.